Today what we're going to talk about is another component of our lower quarter functional examination. Now the purpose of the lower quarter functional examination is to establish dysfunctional movement habits that our patients have that might be driving their pain generating tissues. So what we're going to do is go through three different components of this one particular test and see if there's any dysfunctional movement patterns that we can then address with specific corrective strategies. What we need to do first is establish, one, which you should have already started this in our fundamental neuromotor activation process, but establish their ability to create what we call a VPAC, a volitional preemptive abdominal contraction, which is a categorical term of different active torso strategies to enhance the stability or the active stiffness of the torso. And so in her case, she's been coached on the abdominal drawing in maneuver, which is a way to access her local system, i.e. the transverse abdominis, internal oblique, and deep multifidus. So we want to make sure she's able to do that. Her preferred cue is create pressure under my thumb. So I'm going to palpate about an inch inside her ASIS, sink them down into the abdominal wall, and she's going to create a little contraction, which is going to swell up and put pressure on my thumbs. And so she has a very nice contraction without any substitution. So she's worked very well on that. So let's see how she does with movement. What we want to do is establish the passive range through which they have to control. So I'm going to show you today a test for rotation control. So in supine, normally what we would do is have them cross their arms here so that they're not creating a wider base of support and enhancing their stability that could mask some of those movement dysfunctions that we're trying to uncover. For the sake of the cameras, we want to be able to see this area very well, so I'm going to have her put her arms down at the side. Now, what we're going to do, I'm going to put her feet together, and I'm going to examine her passive range of motion. I'm just going to show you on one side so you don't see my better half. We're going to do this side. So I'm going to come here and I'm going to stabilize her pelvis by placing my hand on her ASIS, my elbow down on her other ASIS, keeping a horizontal orientation. I'm going to use my chest to buttress her right leg, and then I'm going to just move this leg down towards the floor. And we're just going to see how far she's able to move, which is very flexible, right? So what we want to see is she able to control motion in the range that she has available? If we see movement dysfunctions occur beyond that range, that's not an active movement dysfunction. That's just a natural consequence of the tissues reaching their end limit and then carrying the pelvis over into that range. So that's not what we're interested in this case. Now, we've established her passive range. What we're going to do is ask her to silence or quiet down her abdominal muscles. And we want to be very careful of the cues that we give. We don't want to coach them up. We want to see what they own, not what they rent. So we're going to use very specific terminology. And so I'm going to use an external target, i.e. the floor in this case. I'm going to say, please lower this knee towards the floor and return it. Good. We're going to see what happens. Now, what we're going to do here is create that VPAC, so the abdominal drawing in maneuver. So she's going to build that pressure under my thumbs, create that tension, maintain that contraction, and repeat the same maneuver. And we're going to see what the difference is.